Hello everyone from everywhere. I'm Ghaith Ghazi, a final medical undergraduate in University of Baghdad, an affiliate on the RCSED and an associate member in SAGES, International and Asia Pacific HPB Association. Today we're going to talk about what's called anal fissure or fissure in anal. And basically it is one of the differential diagnoses or one of the etiology or causes of a painful anal condition which composes of anal fissure, complicated hemorrhoids or what's called a thrombosed pile. Other is anal abscess and other is anal cancer. Anal fissure is one of the most common complaints under this umbrella. So today we're going to understand its definition, how does patient present, and how to approach those patients with such complaint. A fissure in anal or anal fissure means it is a break through the anal derm. And what else? It is distal to dentate line. Now, what is the anoderm and what is dentate line? Basically, the anoderm means the skin of anus. Now, what is the dentate line? In such a drawing or figure, it illustrates a cross-section of the rectum, of the anus, which composed of the anal canal and anal opening. The mucosa of the rectum is composed of what's called a columnar epithelium here. This one is chained into a cuboidal epithelium here in the level of the anal mucosa where the rectum is changed into the anus. And basically, once we go more distal, it will be changed into a stratified squamous epithelium. And the line of demarcation, which is at this level, is called a dentate line, where not only the type of epithelium is changed, however, the color is also changed from being a bright red or pink into a much pale color or white. In which it will be furthermore, once we go distally, it will be changed into true anal skin and a pigmented skin. And basically this is the definition, where actually anal fissure goes into a two classification. The first one is called acute anal fissure and the second one is called a chronic anal fissure. Now, what is the differences? Basically, it's the same as other condition differences in other diseases in medicine, so it depends on the duration. Acute means the condition is resolved within 4 to 6 or even 8 weeks, while those chronic not resolved in such period. And that's why it's divided into those issues, and each one got its main type of treatment and management, and we're going to talk about the details of all of those in a moment. Now, what else? Other definition or other classification of anal fissure is associated with its position. Well, let's assume that the genitalia is located here. This is the anus from the outside. There is what's called a posterior anal fissure, which is the most common one, where you can see that the fissure is directed toward this way. And there is what's called an anterior anal fissure, where it's directed toward the genitalia. This is composed of 10% of the cases, and what's called a lateral fissure in this way, and this is composed of another 10%. However, 80% is posterior. And the lateral one, it's mostly associated with another pathology, for example, in Crohn's disease. So we're going to have a posterior one, which composed of 80% of cases. We're going to have a lateral one, which composed of 10% of cases. And we're going to have also an anterior one, which composed of 10% of cases. Now, we need to understand, how does anal fissure happen? I mean, why do some patient is suffering and complaining of this complaint while other people is normal? And this goes behind the cause, pathophysiology, and pathogenesis. Well, basically, the etiology behind anal fissure is not understood till now. However, there are some of the causes might be behind this one. For example, a hard stool where there will be a tear in this area, basically in here, which could be extended toward the skin. Now, what about the pathogenesis? I mean, how it is happening? Basically, this is due to a stretch in the anus, in the anal canal, and this stretch will lead to a breakthrough the epithelium. And in chronic issue, and why it's happening, because there will be a spasm due to the pain. This spasm will lead to a further stretch, prevented from healing, so the acute phase will go to the chronic phase because it is not healed. And actually, one of the symptoms that could present due to this one is constipation, as we are going to talk about it in a moment. Now, how to approach those patients? Well, basically, once we're going to talk about any approach for any disease, we're going to talk about history, we're going to talk about examination, and we're going to talk about treatment. Now, regarding history, basically, in the history, we need to focus on the symptoms of anal fissure, which could be pain, which is the most striking one, and you can see that simply once the patient enters into the room of the examination that he has this complaint once he refused to sit, or once he sit on the chair but on the tip or on the edge of the chair, because once he sit on his anus he will have a very agonizing pain. And the second one is bleeding, because as you know, this is a breaking through an epithelium, and it may associate with a bleed. And the third one, which could be possible, a constipation. And the reason behind constipation in such case is that once there is a pain during the defecation, subconsciously the patient will have an inhibition for the desire to defecate because of the pain. So this might end with constipation in some patients. Well, what other to focus on history is the presence of a previous history of the same condition, because once the patient who has a previously anal fissure not responding to the management, either because of the patient himself is not adhering to the management, or either because the fissure itself is turning into a chronic issue, and we need to consider a new line of management. This is regarding history. Now, what about examination? Basically, in examination, we're gonna talk about two main issues in such area, which is inspection and palpation. And once we need to start doing those both issues, we need to position the patient in the proper position. And the proper position for anal examination, either putting the patient in what's called a left lateral position, or putting the patient in what's called knee elbow position. So once we put the patient in this position, we start by inspecting the area or the skin of the anus. In such issue, for example, in this picture, there is an anal fissure which is located anteriorly associated with a skin tag. And once we find a skin tag, this hints about the chronicity of the condition or chronicity of the disease. But if we do not find those fissure or skin tag externally, we need to separate the anal opening and look inside, because maybe the pathology or the fissure is not breaking through the external skin till now. So we need to find it here. And please, once we do the examination for the anus, and once we find the pathology, we don't need to skip the examination and finishing it. We need to complete the issue and goes with palpation to palpate, because there may be another associated pathology associated with a fissure. For example, there may be a fissure outside and an abscess inside, and we need to complete the examination, and thus we moved and passed into the other step, which is the treatment and management accordingly. And please, there is a cautious issue, is that once we find an anal fissure, a DRE, which is a digital rectal examination, is contraindicated. Why? Because it is very painful. That's why we don't need to do a DRE, digital rectal examination, in those with anal fissure. Now, what about the treatment? Well, actually, regarding the treatment, it is divided into a conservative, non-surgical, and a surgical options. Well, guys, conservative is used for acute anal fissure. So we start with conservative, and once we fail, we're gonna shift into surgical. And actually, the time of the treatment of conservative treatment should be from 4 to 8 weeks. And once it's filled after 8 weeks, I mean this condition start to be chronic, so we need to go with surgical issue. Now, what are the choices of conservative management? Well, it starts simply with a hot sits bath. It's recommended to relax the sphincter. What else is local cream? What else is laxative? What else is calcium channel blockers? And of course, locally, this help to relax the sphincter. What else is lidocaine gel? And what else is nitroglycerine, which also help to relax the sphincter and thus decrease the stretching forces and thus improve healing of the fissure. And you need to alert the patient in this case, once you give him a nitroglycerine, that there will be an associated headache as one of the side effects of the drug, and you need to tell the patient that this headache will be tolerated as much as he will keep using the drug, because once you don't tell the patient, once he will have headache, he will quit and skip this drug, and he will fail with the conservative treatment. Now, what about the surgical one? Basically, this is used for a chronic fissure that does not heal with a previous conservative non-surgical methods, and the choices that we have is either surgical excision, surgical removal of the fissure itself, and what else is lateral sphincterotomy. And this is used to decrease also the pressure exerted by the sphincter, and thus this will decrease the stretching and the fissure and will improve the healing. But the issue or the complication with the surgical methods are the incontinence, which could be either transient or sometimes, unfortunately, permanent.